This is a stimulus update and daily news report. Got some important update to share with you. President Biden doubles down on what he says about Putin not remaining in power and doesn't walk back anything. I'll play the exact clip of what President Biden says. Bernie Sanders is calling for Medicare for All, saying that everybody, regardless of age, should have access to Medicare and free healthcare. I'll play the video clip of what he says. When it comes to stimulus, one representative has just announced a $500 federal gas stimulus check proposal program. Also, gas stimulus money, here's who would get $100 when prices spike if new bill passes, and surprise stimulus check worth $300 coming to half of Americans. See the exact date your cash could arrive, and I'll give you some other important updates as well. Hope you're having a terrific Tuesday. If you appreciate the fact-based, fast-paced updates, hit the like button down below, and I'm giving $200 to my subscribers in just 2 days. I'll talk more about that later on in the video, but first, got some COVID news here. Be ready to pivot back to COVID restrictions, Anthony Fauci warns leaders. So basically saying that we could be going back to a more rigid type of restrictions should another potentially harmful new variant emerge. So this comes as we're getting a lot of news in Europe. So coronavirus cases are rising in European nations because restrictions were eased too soon, according to a World Health Organization official. And then in China, we're seeing some of the news. Shanghai starts China's biggest COVID-19 lockdown in 2 years. Now, I'm not sure how it is by you. Let me know down in the comments below. In your area, things calm down. In my area, in Myrtle Beach, South Carolina, things aren't too serious. Almost nobody wears masks. It's almost like life is back to normal. But let me know how it is in your area, and are you concerned about this? At this point, I don't think there's any cause for concern, but I'll keep you updated on that. Also, I make no apologies. Biden stands by Putin cannot remain in power remarks. So this remark from President Biden caused a big global stir. A lot of people are wondering if this is going to escalate the war, escalate things in general. Take a look at this video clip right here, President Biden doubling down.
Do you believe what you said, that Putin can't remain in power? Or do you now regret saying that because your government has been trying to walk that back? Did your words complicate matters?
Well, you asked 3 different questions. I'll answer them all. Number one, I'm not walking anything back. The fact of the matter is I was expressing the moral outrage I felt toward the way Putin is dealing and the actions of this man. Just brutality of half the children in Ukraine. I had just come from being with those families. But I want to make it clear, I wasn't then, nor am I now, articulating a policy change. I was expressing the moral outrage that I feel, and I make no apologies for it. My personal feelings. Secondly, you asked me about, well, what was the second part?
Complicate the diplomacy of this moment.
No, I don't think it does. You know, the fact is that we're in a situation where what complicates the situation at the moment is the escalatory efforts of Putin to continue to engage in carnage, the kind of behavior that makes the whole world say, "My God, what is this man doing?" That's what complicates things a great deal, but I don't think it complicates it at all.
Mr. President.
Let me go to Steve Holland, Reuters.
Mr. President, thank you. When you say that you're not walking anything back, you do feel that Vladimir Putin should be removed from power? Is that what you're saying? And
no, what I was expressing just what I said. I was expressing the moral outrage I felt towards this man. I wasn't articulating a policy change. And I think that, he continues on this course that he's on. He is going to become a pariah worldwide, and who knows what he becomes at home in terms of support.
What are your thoughts on that? Was that the right thing to say, wrong thing to say? Could he have said it differently? What do you think about him doubling down? Do you agree with him? Let me know your thoughts on all that down in the comments below. Next, let's get into stimulus news. So Arizona residents could be in line for $22 million in stimulus funds. So many tenants owe their landlords months of past due rent and risk eviction in absence of being able to pay. And Pima County and the city of Tucson are making $22 million in rent relief funds available to residents. So if you live in Arizona and in those areas, it looks like $22 million for extra rent relief, rental assistance. And then gas stimulus money. Here's who would get $100 when prices spike if new bill passes. So this is that new bill proposal. Basically, a group of federal lawmakers are pushing for a bill that would provide $100 monthly stimulus payments to some people when gas goes above $4 per gallon. So basically, under this, you could get a $100 check plus dependent, and anyone making less than $75,000 or less. As a single, joint father is $150,000 or less. And this, at this moment, you could get, $100 for you, $100 for your spouse, $100 for dependent. At this moment, it hasn't really moved forward, so it's just a proposal. A lot of people would love to have it, but at this point, it's not moving forward. Just want to keep it real with you there. And then we got this new proposal announcement. Representative Josh Harder announces $500 federal gas relief check program proposal. So formal federal proposal for putting gas money back in your pocket act to come Wednesday. So basically, a Congress member in California announced that Monday he would be introducing a $500 federal gas relief check program proposal to all taxpayers later this week, coming off the heels of 4 major proposals within California similar to relief and rebate programs this month. Basically, in an interview saying that putting gas money back in your pocket act would send $500 to all taxpayers. Those filing jointly would receive $1,000, with all dependents age 16 and above also getting $500 due to being of driving age. So this is an interesting proposal here. I'll keep you updated on what happens with that. And then surprise stimulus check worth up to $300 to half of Americans. See the exact date your cash could arrive. So this is going on in the state of Delaware. So it looks like $300 stimulus checks are going on in Delaware, and it's hoped that taxpayers could get the cash before June 30th. So Delaware, $300 checks to around 600,000 residents there. And then Bernie Sanders vows to reintroduce Medicare for All as Biden extends privatization ploy. So Bernie Sanders is pushing for Medicare for All, basically making sure that every American has access to free health care. Let me know your thoughts on that. Good idea, bad idea? Take a look more of what Bernie Sanders has to say about that.
We are all aware of the enormous crises facing our country and the world. We see the horrific war and suffering in Ukraine. We're more than aware of what the scientists are telling us about climate change and the existential challenge that it poses to the planet. We are mindful of the current pandemic, which has already taken almost 1 million lives in our country, and the likelihood of future pandemics. We are outraged by the massive level of income and wealth inequality in America, the fact that half of our people live paycheck to paycheck and struggle every day to provide for their families at exactly the same time as the very wealthiest people in this country become richer and we move toward an oligarchic form of society. And in the midst of all of that, Donald Trump and his allies are moving aggressively to undermine the very foundations of American democracy. But in the midst of all of that, and that's a whole lot, it is imperative that we not lose sight of the healthcare crisis which exists in our country and what that means to ordinary Americans. Today, the United States remains the only major country on earth not to guarantee healthcare to all people as a human right. The result of that is that over 80 million Americans are uninsured or underinsured with large deductibles and copayments. In America today, we spend far more per capita on healthcare than any other nation, almost $11,000 per person, while at the same time some 60,000 Americans die every single year because they lack insurance and are unable to get to a doctor on time. In America today, we pay by far the highest prices in the world for prescription drugs. In some cases, as much as 10 times higher for the same exact drug as sold in Canada or in Europe. The result of that is that 1 out of 5 patients in our country are unable to fill the prescriptions their doctors prescribe, and many become unnecessarily sicker and sometimes even die as a result of not getting the medicine they need. In America today, we have a major shortage of doctors, nurses, and other healthcare professionals. The result, in many parts of this country, especially rural areas, it is increasingly difficult for people to receive the medical attention they need in a timely manner. Meanwhile, in the midst of this doctor and nurse shortage, young people are leaving medical school and nursing school hundreds of thousands of dollars in debt. Dental care in this country is outrageously expensive, and millions of Americans, including many seniors, do not get the dental care they desperately need. A significant number of dentists do not accept Medicaid payment, which means that lower income Americans cannot get to see a dentist, even when they're in pain. At a time when over 100,000 Americans died last year as a result of drug overdoses, it is clear that we are looking at the worst mental health crisis in the history of our country, and we have barely begun to address it. And these are just some of the crises facing our dysfunctional healthcare system. In my view, and I have said this for years, healthcare is a human right and not a privilege. Simply stated, that means that every man, woman, and child in our country should be able to receive the best possible medical care available, regardless of their income. That means that when you're sick or you're in need of an annual checkup, you should be able to walk into the doctor's office of your choice and get the care you need. No forms to fill out, no deductibles, no co-payments, no bureaucracy, just you and your medical provider. There should also be a much greater emphasis on disease prevention, keeping us healthy rather than just treating us when we're sick. Let us be very clear. None of this will happen so long as our healthcare system is controlled by private insurance companies. That is the simple truth. The function of private insurance is not to provide quality care for all, but to make as much money as they can for their stockholders and to pay their CEOs outrageous compensation packages. That is why we need to move to a Medicare for All single-payer program. But as I think you understand, taking on the giant insurance companies, their lobbyists, their apologists in Congress, and the fear-mongering we face from the corporate media will not be easy. Just as one example, the pharmaceutical industry itself, just the drug companies, spent some $300 million in lobbying to make sure that Congress did not lower the outrageous cost of prescription drugs in this country. They had over 1,500 paid lobbyists on their payroll, 3 lobbyists for every member of Congress to protect their interest. And that's just the pharmaceutical industry. But the good news is, despite all of that, is that in recent years, more and more Americans have come to understand that the current healthcare system does not work for them and needs to be fundamentally changed. The pandemic, in which millions of workers lost their employee-based health care through no fault of their own, made the absurdity and the irrationality of the current system even clearer. And the increased support we are seeing for Medicare for All is coming not only from healthcare consumers, not only from ordinary people, but is coming from doctors and nurses and healthcare professionals all across the board.
Let me know down in the comments below, do you agree with Bernie Sanders? Should healthcare be for everybody? Is this the right thing to do for America? Other countries have done it, according to Bernie Sanders. Should America do it as well? Let me know your thoughts on all that down in the comments below. And that is all the news that I have for you today to hopefully brighten your day a bit. Here's my daughter Bella's tip of the day.
Guys, this is Bella. This is the tip of the day. And what I was gonna say is just enjoy the moments right now. Don't be like maybe I'm not good for this. Just do it. Something, if you want to do it, then you can. Because it's just a one-time thing, because you should always do something now than always later, because then it might not be the right time and it might not be the right ending. You might have like people or like
Thank you so much for watching. Don't forget, if you want to sign up for the $200 checks, I have details to that down in the description below. And hopefully you have a great rest of your day. If you want to check out any of my other videos, my other channels, you could click up here, and I'll see you in the next video. Take care, be safe. Thank you for watching.